So today we're going to learn how to use the V-beam laser. The V-beam laser is a pulse dye laser, and there are various components to the laser. There's a handpiece, and there's an on-off switch. And so basically you turn the switch and this has to warm up, and it takes about, I don't know, 15 to 20 minutes to warm up. And that's a rate limiting step in this procedure.
So we're going to put on protective goggles for everyone in the room when using the V-beam laser.
Okay, so goggles for you, goggles for the pit. Don't put the no one's face should be in the picture.
Right.
But my face can be in the picture, and I'm going to put goggles. And the question is, we need another pair of goggles. And so what I'm going to actually do is I'm going to have you put on these. I'm going to put on these, and you're going to put on these and close your eyes. Okay.
No, this feels like,
Okay,
this
next.
doesn't feel like it's covering my eyes, guys.
No, it's enough. I promise. So long as your eyes are closed and they're covering like that, it's perfect. Okay.
Okay, so we're going to take out the laser handle from the machine.
Okay.
If the appropriate spot size adapter is not on the machine, you unscrew the two wires from the handle.
So, okay, here we want a 7mm spot size you got in there. If I didn't, I pull this one out, I unscrew this. There's a button here I press. I push this button, and then this thing slides out. And if I want to put it back, I have to push the button in again, because if you look in here, there's a little mechanism. You see that?
Mm-hmm.
Okay, and so I push the button in, and I slide this in. It's in place, and then the red dot aligns with the red dot. You see that? Yes?
Yep.
Okay, so that goes in, and then this screws in. And you have to push towards the machine while it screws. Okay, next.
So you're to clean the desired spot size adapter with alcohol.
Okay, so I'm just going to put this back in here for a second. And I need a 7mm spot size. And this is a 10mm. Lots of 10mm things here. Here we go. So you just pass me an alcohol swab. And you can see here it says 7mm on the thing. I don't know if you can see that from in the light. Yes?
Yeah, I'm not sure.
Like right there. It says 7mm.
Okay.
Anyway. Okay, so I'm cleaning this off with alcohol. Very good.
Then you insert the desired spot size adapter while pressing down the white release button. Then allow the white release button to click into place.
So, oh, you know what? That is man, that's not right. So I have to edit that. Okay. Well, anyway. Okay. So just delete that step. But basically, we put in the 7mm spot size. In order to insert this, if you can look inside here. So you have to angle it slightly downward, and it goes in. If you put it in straight, it doesn't fit. So it's an angle slightly downward, and then it goes in. You should never force anything. Okay, now let's look at the control panel. And you can adjust what measurements you want. So I press on. First of all, it's on standby. This is ready. This is standby. Okay, and here's the joules. I wanna first adjust my spot size down. I mean my pulse width down. I mean it can go all the way to high or all the way to the least. And since we're going to be doing a wart here, I want a short pulse width, and I'm going to go the highest energy as well. Now, in order to calibrate the machine, see if I press standby. and try to push the button. Okay, I'm gonna go like that, and it's gonna say insert the handpiece because I have to calibrate it. Every time you change the setting, you have to calibrate. Okay, so I press OK, and it's calibrating. Alternatively, I could have just pressed this button and it would calibrate automatically. Okay, now it's ready, so I want to put it on standby because when I'm futzing with this, the discharge mechanism is this button here, this black button. So I'm going to put the piece on the handle, and it doesn't matter which way it goes, it's symmetrical. And now I hold this here, and I can press. Okay, so now I'm going to go to ready, and if I missed any step, just jump in there. Okay.
You got them all.
From a dictation standpoint. Okay, so now here's the lesion of interest. Okay, and my glasses are falling off, but so the lesion of interest is here, and I'm basically going to get all around the wart. So you're going to see here a flash of light as I press. So first of all, I don't want to be off, and I have to be exactly perpendicular to where I want to go. Okay, you're going to see a flash of light and a zap. Oh, I gotta put it. Well, it's ready. Why isn't it going? There we go. Okay, you want to warn the patient that you're gonna do this. Okay, so another zap. Okay, and now you see that there should be a little bit of purple hue to the skin, and that's the purpura from the laser beam frying the blood vessels. Okay, again. And I actually like to close my eyes when I actually fire. Okay, and we're just going to continue along here. And again. And now the patient knows that it's coming by the Pavlovian response of the plastic touching her skin, and then she knows that it's coming. And I'm going to stack the pulses, meaning do it one over the other. You know, how you actually treat, whether you stack pulses or do not stack pulses, depends on the lesion and the treating physician's preference. And the idea here is you can see how there's like some purpura here. And that's basically it. Now, when I'm done, as I am now, I'm going to hit the standby, so you can go over here. I was on ready, and now I go to standby. And standby is good so I don't accidentally discharge the laser. Is that it?
Yep. Set standby and reset.
Oh, yeah. Okay. Let's say I realized that, hey, this wasn't the right setting. I didn't get enough purpura or whatever. So then I can take this off. I can put this back, the handpiece back in the machine, and now I can adjust whatever settings I want. I can make it a longer pulse width, less energy. Then I would recalibrate. And then I would put this thing in again and, you know, start again with the laser. So, I think that's it. Thank you.
The only thing I could say on this is that the exhale, to tell the patient to inhale